Hi, I'm Dan Ross, and in this video I'm going to talk about dealing with depression. And in this series of videos we've talked about depression tests and quizzes. There's a series of questions you can ask to determine whether you may be experiencing that. We talked about some tools on how to resolve that. So there's a couple of different tools I've given in the other videos. And in this one we're going to really talk about dealing with it. And first off, I just want you to be aware that if you want a formal diagnosis for depression or any other mental disease or disorder, a formal diagnosis can only be given by a licensed therapist or psychiatrist or other similar mental health practitioner. I am not that, I'm not licensed, but I do hypnosis and other tools to help people resolve issues and lead better and happier lives. So we talked a little bit in other videos about the common symptoms and some questions to ask about, is this going on for a period of time? Do you not enjoy the activities you normally do, or just not enjoy them as much, or do you not even do them? You don't, have trouble getting out of bed, just want to sleep all day, or you just have like negative self-talk and just sort of kind of feel down. So. And then we talked about what the common causes are. So there's three elements that I believe go into what people report as symptoms of depression. And I've seen this in almost everybody that have come and reported those symptoms. And that is that there's a combination of things that people see in their mind and they hear in their mind and they feel in their body that are going on when they're reporting depression symptoms. So they're often seeing negative pictures in their mind. There's negative self-talk, and there's these sort of down feelings. And I think if you took any person off the street and said, I just want you to think about something really bad that happened, see it in your mind, talk to yourself about it in that way and really feel down, then I think they would report the same things as well. On the flip side, if you take any person off the street and say, think about something really happy, something that makes you joyous. And if they could really go there and see that and have that self-talk, they would probably, their face would light up, their body would move upward, their volume and their tone would increase, they get more animated, and they would probably be reporting, happy or joyous feelings. So the first concept here is just that, this stuff is in your control. So the problem is most of it is unconscious, and as a hypnotist, I'm very aware of working with the unconscious mind and for looking for these unconscious patterns that people do. So for example, I was talking to a client and this person said, yeah, I was just going about my day and I said, you dummy, you did that again, and then I went to my next appointment and then blah, blah, blah. And it was so matter of fact, I didn't even catch what they said in there, right? There was some negative self-talk that they were reporting that I heard, because I'm attuned to listen to that, but they were not even aware of it. It was unconscious. So look in the other videos, because I have a series of assignments about just noticing that, but I'll give you the summary here, which is, imagine you had like a remote control and you could pause your thinking around the time of when you started having these bad feelings. And just notice what you may be seeing in your mind and what you may be hearing talking to yourself. And just notice how you may be standing. Like we said, freeze. I was just in the middle of saying, yours do, right? And sort of picturing something not working out, like you're standing talking to somebody, flubbing something, whatever it is, right? Just notice where that is. We're taking the remote control, we're hitting pause. And that will help you become aware of what's actually going on in your mind and your emotions when you're reporting these symptoms of depression. This is one way of dealing with depression, is to first of all find out what it is you're actually doing in your mind. And there's nothing wrong with it. It all serves a need or a purpose, even if we don't know what it is. And the first step in dealing with it is finding out what it is you're doing and doing something different. It's just about making a different choice. There's nothing, nobody's wrong, nobody's broken, there's nothing like that. It's just, there's something that has become an unconscious pattern in your mind that we just want to have you do something else. So this sequence of negative pictures, negative self-talk, and this sort of negative body physiology, this is the pattern we want to break. It's like if we take a record, if you remember records, and it just plays over and over and it's unconscious, right? It always plays the same way. So it's always like, you dummy, you didn't do that right? It's this record that's playing. And we're saying, well, we're going to take it, we're going to put it on a different track, or we're going to scratch it, and we're going to make it so it doesn't play the same way. So the first thing I want you to know is for a tool for today, the first tool is actually just be noticing what's going on when you're reporting these symptoms. And then the second one is think about what kind of pictures and movies you may be making in your mind that go along with that. So, for example, I had a client who she was having these bad feelings when she would go outside, and especially if she went into like a big store, she would make this picture in her mind of somebody coming up and approaching her and like harming her physically, and that was the record pattern that she was playing over and over in her mind. And we had her change that, because of course that's not how we want to imagine going out into the world, right? So think about some picture or movie that you play over and over in your mind that's not really good for you. And all I want you to do is imagine pushing it far, far away. Push it 10 feet out, 20 feet out, push it all the way across the room, and just allow it to go over there. And as you allow that to go far away from you, notice what may happen to your feeling. And if there's some sound or some self-talk to go with that, allow that to go all the way across the room too. So it's almost like you're watching it on a very small TV set 20 feet away. Remember when they made those tiny TV sets, even back in the old days? Or it could be the size of a tablet, but if you're watching something on a tablet that was 20 feet away, the picture would be small, it'd be kind of dim. The sound would, you just barely hear it. And just notice what happens when that negative picture is that far away. And then allow that to stay wherever it's going to stay. It may need to move a little closer just so you can kind of, because sometimes there's information there about stuff to avoid, so we don't want to just kind of get rid of it. But sometimes for people it's like right in front of them, and that's definitely not good. So put it where it needs to stay. That's hopefully just far enough away that it's started to lose some of its negative feeling. And in these videos, we talk about changing all of these things, right? I already gave you this example of changing your physiology. We can allow the sound to move away like we did in this example. On the other videos, we change the quality of the sound. We can change the qualities of the picture like we did, or the movie. We move that far away. And we can always go deeper. So this is sort of the first step when I'm working with a client, is just helping them find out what it is they're doing in their mind that's causing the problem. And then we start to play with some of these solutions. And sometimes there's something deeper that's going on that actually causes them to have this negative self-talk, or to make these pictures that aren't useful. And that's the kind of thing we do in a private session, where we can work one-on-one, and we can really dive into the cause of that. Again, there's often something that goes on in personal history that people are playing over and over to this day. Something triggers them, and that's what's happening. So if you want more information about that in terms of just dealing with depression and going a level deeper, or to resolve any other issue, contact me for a consultation. We'll make sure we're a fit together. Otherwise, I will see you on the next video.